Welcome back. We're talking about adult stem cell therapy and regenerative medicine. This is the time that you can call and ask your questions. The number to call is 0808-054-2233. Again, that's 0808-054-2233. And you can tweet at CTV_Mary A. And right now there's a tweet from Ope. Ope is asking, can regenerative medicine be used to change genotype from AS or SS to AA?
It cannot be used to change genotype, but it can be used to change phenotype.
And what does that mean?
Okay. You see, even in Nigeria here, there have been successful cases of sickle cell patients being treated. But this is allogenic, that is the bone marrow stem cells from another human being. Okay. When the process is completed, the sickle cell patient will now stop being sick from sickle cell disease,
from crises,
or the crisis
and other things.
Yeah, and stuff like that. So they'll be having AA, but the genotype still remains SS.
So in other words,
if
he won't have the effects, but he can have a child with
Thank you. Thank you.
Okay.
So they seem to do counseling when it's time for them to get married. Because now they are disease-free. Does that mean that they are free to marry an AS or SS partner? So they still have that risk of giving birth to sickle cell children if they don't do counseling or test themselves.
Okay, Morgan is asking if you have regenerative medicine for children.
Regenerative medicine is the name of the field of the medicine.
Okay.
But I think the question the person is trying to ask is, can adult stem cell therapy or PRP be used for
to help children?
The answer is yes. In Nigeria here, there are children or pre-teenage group children that either with cerebral palsy that have been treated and already started improving. And that quickly to mention, anything with neurological disorder needs more than one treatment, because in medicine we believe that central nervous system does not regenerate until regenerative medicine comes into play.
Several sessions, but it can be done.
That is
can
correct.
It be done for Alzheimer's?
Alzheimer's disease, yes, that's in elderly people. It helps people's memory to come back. That we need more than one, but it's not a gold standard for Alzheimer's yet.
Okay. Now, Adesonia is saying regenerative. Okay, let's take a call first before we go to Adesonia. His is important. Let's take this call. Hello.
Hello.
Welcome to the show.
Yes.
What's your question?
Please, I want to find out if the regenerative medicine for adults can work for glaucoma.
Glaucoma. Okay, thank you very much. Doctor, over to you.
Yeah, glaucoma is more of a problem with the cloudiness of the lens. So the pressure in the eyes.
So it's an optic nerve thing.
Yeah, it's inside the eye there's a fluid before and after the lens.
Okay.
And then when there's increased pressure, that kind of increase. So right now there are research going on how it can be applied for glaucoma, but the final stage or clinical stage has not been reached to say that okay, now it is saved.
Okay.
So but that's something in progress.
All right, so back to Adesonya's comment. He's saying regenerative medicine is the new line to life prolongation. That brings me to my question. Can this renew youth?
The answer is yes. Because I also have a relative, with diabetics that was treated with adult stem cell therapy, who is feeling younger, looking younger, more active.
Doctor, before you finish that question, let's quickly take a call. Calls can wait. Hello. Hello, are you with us?
Yes.
What's your question?
Hello, good afternoon.
Good afternoon.
Yes, good afternoon.
Good afternoon. We can hear you. Go on with your question.
Okay, my question is, I want to find out what the regenerative medicine for adults is.
Oh, okay. You must have joined us a bit late, but can we quickly go over that?
Yes, regenerative medicine is just a branch of medicine that aims to restore normal function, by repairing or replacing damaged cells in the body, and the damage could have been due to age, due to congenital defects or disease.
Okay. Before the calls came in, we're talking about whether you have to cut open your patient to apply the stem cells.
You do not. There are 3 ways of giving the stem cell. First of all, the 2 main types is bone marrow as the source or the fat. For the bone marrow, you have to drill a hole into the hip area, you make the area numb, you get your bone marrow, you process it. For the fat, the way it is being done is not a major liposuction. We call it mini liposuction. Patient is fully awake. You numb the stomach area. You take out the fat you need. That's less than 45 minutes. But you spend about 3-4 hours harvesting the stem cells from that fat. Now, when you get your stem cells, either from the fat or from the bone marrow, you now go into action and use it depending on the disease. So into the vein, into the spinal cord, or locally, which could be the joint or the hair loss.
Okay, can you take a look at this picture? What's happening here? Is it a harvest of stem cells or arthritis is being treated? Okay,
this is platelet-rich plasma. This is harvesting the platelets from the blood. In the upper left corner there, you can see the patient's hand being stretched out. You draw the blood, you spin it, and then you take the rich part of that plasma that is rich in platelets and inject it into the area where you need it. And it could be the shoulder, the hip, the knee joint. It could be for hair loss. It could be for private parts. It could be for, any part of the body where
That's you.
Yes.
What's happening to you? Okay. Let's take our call first. Hello. Hello. Are you with us? Could you speak up, please?
Yeah, I can hear you.
Okay, go on. What's your question?
Okay. My question is about this regenerative medicine for adults. Okay. I want to find out where this treatment can be secured within the country. And my name is Ken. I'm actually calling from Delta State.
Okay, thank you very much, Ken. Do we have this commonly in Nigeria?
Yes, there are centers in Lagos, Abuja, where these procedures can be done. Yes.
Okay, Lagos and Abuja. Well, we were talking about the harvesting of the stem cells. Okay. The question I want to ask you is, if somebody has arthritis, for example, I believe what needs to be regenerated is, okay, let me just call it stuff for a better word. You give me the word. Between the bones.
Yes.
To make movement more fluid.
Yes.
But if it's the pancreas, we're talking about a regeneration of the pancreas so that it can give insulin. Mm-hmm. Do you have a particular way of making it differentiate itself to what is needed in the body, or that is automatic when you inject the stem cells?
Okay. For regenerative medicine, there's platelet-rich plasma and other stem cell therapy. For the stem cells, you just inject it into where you need it, locally, for example. Okay. Then the stem cells go into differentiation.
By themselves?
By themselves. They identify where the problem is, you use the cell-to-cell communication and take care of the problem. But when you do use PRP, platelet-rich plasma, that's what we also call A2M, alpha-2 macroglobulin. This one, they stop the enzyme that heat up the cartilage in the joint.
Okay, so they take down inflammation.
Yes, and make it work.
I'm afraid that's all we can take on the show. Thank you so much, Dr. Ikudaisi, for coming. It's been wonderful having you.
Thanks for having me.
Thank you for being there with us, all the viewers and all the callers. Have a wonderful day. I'm Mary Alale Yusuf.